Bismillahirrahmanirrahim. This is the 12th lecture on general toxicology, and in this lecture I'll be discussing the use of antidotes in poisoning. An antidote is a substance which can counteract, negate or neutralize the effects of poison without causing harm to the body. And most important is that this term derives from the Greek term pharmakon antidoton, meaning medicine given as a remedy, because they used to give medicine as a remedy, and this antidoton, the term derives from that antidote. Now, regarding its indication, they are given when the poison may not have been completely removed by emesis or gastric lavage. That means the poison is still in the stomach, then it is given. They are contraindicated when the poison has already been absorbed or the poison administered by other routes, then they are contraindicated. The groups of antidotes, commonly there are four groups: mechanical or a physical antidote, chemical antidote, physiological antidote, and pharmacological or receptor antidote. And there are two other, the dispositional antidotes and the universal antidote. Regarding the mechanical antidote, they basically are the products or the ingredients which impede, which stops or blocks the absorption of the poison by their presence, such as demulcents, bulky foods, and charcoal. They act by physiologically. Demulcents form a protective coating on the mucous membrane of the stomach, and it retards the absorption of poison through the stomach mucosa. This is very effective in corrosive and irritant poisons. For example, the most common examples are the fats, the oils, the milk, and the egg albumin. Then the bulky foods also include bananas, which acts as mechanical antidote to glass by imprisoning its particles. Then activated charcoal also adsorbs alkaloid poisons. Now, regarding the chemical antidotes, they are the substances which act chemically with the poison to form an other compound which is either non-toxic or is less toxic, like dilute acid or vinegar which neutralizes alkalis, or dilute alkalis like magnesium oxide, it neutralizes acids. Similarly, the calcium salts is given, it combines with oxalic acid poison to form calcium oxalate. KMNO4 is an oxidizing agent. It is used in cyanide and morphine poisoning. Similarly, the chelating agents like BAL and EDTA are used. I will be discussing how they act. Now, regarding the physiological antidotes, these agents act on biological systems and physiological mechanisms of the drug to oppose the effects of poison. They act physiologically and their actions are opposite to that of the poison. And they produce effects which are opposite to that of the poison, hence they act as antidotes. For example, epinephrine for anaphylactic reactions. Similarly, physostigmine in pilocarpine poisoning. Now, the pharmacological antidotes or receptor antidotes. These are the substances which oppose the action of poison by acting on same receptor where the poison acts to produce its actions. For example, naloxone is given in morphine poisoning, atropine is given in organophosphorus poisoning. Now, the dispositional antidotes. These substances alter the poison's absorption, metabolism, distribution, and excretion to reduce the amount available for the tissues to be exposed to, like N-acetylcysteine. It is used in paracetamol poisoning. It provides sulfidyl groups to generate more reduced glutathione, which is used to metabolize the toxic metabolites of paracetamol in the liver. Similarly, the ethanol is used in methanol poisoning and ethyl glycol poisoning. Ethanol consumes the enzyme alcohol dehydrogenase, and that metabolizes methanol and ethyl glycol. Hence, formation of toxic metabolites is inhibited. Now, what is universal antidote? Universal antidote is a formation which combines of physical and chemical antidote. It's a combination of physical and chemical antidotes and is used in those cases where the exact nature of poison is not known or two or more poisons have been taken. And the components of universal antidote are activated charcoal 2 parts, magnesium oxide 1 part, and tannic acid 1 part. 1 tablespoonful mixed and stirred in glass of water is given. And the mixture is not used nowadays as charcoal adsorbs tannic acid, magnesium oxide, and decreases the efficacy of universal antidote. Tannic acid also absorbs in the blood and produces hepatotoxicity. So thank you very much. This was all about the